Hello, I am Dr. Rohit Ranade. I am a consultant gynecological oncologist, an advanced laparoscopic and a robotic gynec surgeon at the Narayana Health City in Bangalore. Today, we will be discussing a few things about the important topic of endometriosis. So, endometriosis is one of the important problems, gynec problems occurring in women. It mainly occurs in women aged between as early as 15 years and up to even 45 years. Women can have endometriosis. So, to know about endometriosis, so what exactly is endometriosis? So, if you look at the structure of the uterus, it has three layers. The insidemost layer of the uterus is lined by cells known as endometrial cells. Now, due to certain reasons, these endometrial cells are found at some other places, like on the uterus surface. They can be found in the fallopian tubes, they can be found in the ovaries, they can also be found in the other pelvic organs like the urinary bladder, the rectum, or any part of the intestine. Rarely, it can be found also in the chest, which is in the thorax or on the diaphragm. Now, what happens every month in response to hormones, these endometrial cells grow in size. They grow in size, and after the hormonal level reduces in the body, the cells die off and they remain accumulated in these different organs, and that is the reason why they cause pain and other symptoms. Now, what are the types of endometriosis? There are basically broadly two types of endometriosis. One is early endometriosis and second is a deep infiltrative endometriosis. Early endometriosis is where only one organ is affected. Deep infiltrative endometriosis is where the endometrial cells spread inside the organ and they infiltrate and then cause symptoms. It is very important. Now, the most important feature or the symptom of endometriosis is dysmenorrhea. Dysmenorrhea means pain during your menses or during your cycles. This is one of the most important symptom what most of the patients present with. Another important symptom is dyspareunia. Now, what is dyspareunia? Dyspareunia means when you have pain during your sexual activity. When you have or pain during sex is known as dyspareunia. This is also another important feature or symptom of endometriosis. In addition to that, women may also present with features like bleeding through, in advanced cases, bleeding through the rectum, that is a motion, bleeding in the motions, especially when somebody has an endometriosis of the intestine. Bleeding through the urine or red color urine can happen when somebody has a endometriosis of the bladder. Sometimes endometriosis can also cause some fluid in the abdomen, because of which you might feel something like a bloating or a distension of the abdomen. Rarely, endometriosis can also present like cancer. Another important, you can say, sign or a sequelae of endometriosis is that the couple might have difficulty in conceiving because of endometriosis. So, these are roughly some of the important signs and symptoms of endometriosis. Yes, so that's a very important, you can say, sequelae or important effect of endometriosis. What endometriosis does is, because it affects the pelvic organs, it also causes a lot of adhesions. Adhesions is sticking of tissues to each other. So, it causes sticking of the fallopian tube to the uterus or fallopian tube to the ovary, in medical terms, which we describe as pelvic adhesions. Now, because of this, what happens? The normal conception or the normal pregnancy is hampered and the couple find difficulty in conceiving in endometriosis. Now, the treatment of endometriosis is multimodal. It depends upon multiple factors. First important is what is the severity of endometriosis, and second, the expectancy of the couple. Now, because the treatment will be different if the couple is planning for a pregnancy, the treatment will be different when the couple has already completed his or her family and they no longer wish for further childbirth. It also depends upon how severe is the endometriosis. So, for that, you need to do some tests like an MRI or an ultrasound scan, which will help you to evaluate where all the endometriotic deposits are present. Now, once you have your clinician or a endometriosis expert has evaluated and reached to a conclusion, then the treatment of endometriosis is prescribed. Overall, the treatment of endometriosis is of two types. One is either medical, where you will be given drugs or tablets or injections to treat the endometriosis, but the most important treatment aspect is surgical, where a surgery is done and the endometriosis is excised or removed. Now, endometriosis, as I discussed, it is one of the diseases where surgery is a very, very important part of treatment. Now, in layman terms, the surgery for endometriosis involves removal of the endometriotic cells. Especially in young women, you have to be careful because you have to remove only the endometriotic deposits and save a certain part of ovary. That depends upon how severe is our endometriosis. So, in management of endometriosis is definitely a complex situation. You need a multimodal management, you need a good team, you need somebody who is very, very efficient in managing endometriosis. So, overall, it means that you have to remove all the endometriotic tissues, but at the same time preserve the fertility, that is further childbearing. Now, in a situation where somebody has already completed family and no longer wish to have more children, the treatment of endometriosis can be more radical. That is, removal of all the organs may be done in endometriosis. Endometriosis is one disease where a laparoscopic surgery or a robotic assisted surgery is definitely of more benefit. It gives all the benefits to the patients what minimal access surgery provides, that less pain, better recovery, better quality of life. At the same time, the vision during a laparoscopic or a robotic surgery is much, much better, and it allows you to see the endometriotic tissues more better, thus allowing complete excision. Also, the endometriotic tissues may be at different positions, like they can infiltrate the nerves sometimes, they can infiltrate the urinary bladder sometimes. So, all of this needs to be efficiently removed. You might require to remove some part of the urinary bladder when there is an endometriotic deposits which are involving the urinary bladder. You might have to remove a certain part of intestine when the endometriosis has infiltrated the intestine. Overall, the surgery is a complex one and requires a multidisciplinary team, and always we have shown that teamwork always leads to good results.